I'm going to present our studies on hemodynamic factors associated with progressive aortic dilatation following type A aortic dissection surgical repair. The standard surgical approach for Stanford type A dissection repair is to replace the ascending aorta with a synthetic graft. Some patients, however, are at risk of aortic rupture due to further dilatation of the residual dissected aorta, and currently there is no reliable means to predict the risk of aortic dilatation. Therefore, this study aimed to examine the role of hemodynamic parameters in progressive aortic dilatation following type A dissection repair. By review of a baseline and a follow-up CTA images, the aortic growth rate was evaluated as the maximum diameter change per year. The patients were then classified as the patients with stable and unstable aortic diameters. The patient-specific geometries were then reconstructed based on the CTA images. The key geometric parameters, such as the number of reentrant tears and the entrant tear size, were measured, and then the computational flow analyses were performed for all of these 17 patients to obtain the hemodynamic results. The Mann-Whitney U-test showed that the number of reentrant tears and the maximum luminal pressure difference were significantly different between the stable and unstable groups. The multiple linear regression analysis showed that the luminal pressure difference is also the sole independent predictor of aortic growth. As a summary, the pressure difference between the residual true and false lumen is identified as a potential predictor of progressive aortic dilatation in type A dissection following ascending aorta replacement. In the future, luminal pressure difference should be monitored in a large patient cohort in order to validate its predictive power. This knowledge can be used to develop new strategies aimed at minimizing luminal pressure difference, thereby reducing the risk of subsequent aneurysmal degeneration. Thanks for your listening.